Hey everybody, Michael Tracy here. So there is going to be a vote reportedly later today on the Republican healthcare plan, and I don't want to get into the substance of the bill. Other people have more expertise on that. What I wanted to discuss briefly are the political dimensions at work here, namely within the Republican Party and the Congressional Republican Caucus. First, obviously, there is a long standing dispute or gulf between Trump and Paul Ryan. Um, Now, I think that gulf has been papered over some by Trump's triumph and Ryan's desire to appease him to some extent, but it definitely still exists. And there's evidence that the gulf there plays into how this healthcare issue has unfolded. Um, for example, a few weeks ago, Breitbart released a recording in which Paul Ryan basically said that he would abandon Trump. This happened around the time of the so-called Access Hollywood video in October, about a month before the election. And Ryan said, "I am not going to defend Donald Trump, not now, not in the future." So we all know that Trump takes loyalty seriously, or at least that's what he appears to take seriously. He prioritizes and rewards people who declare their unflinching loyalty and subservience to him. And Paul Ryan, at various junctures, has made clear his disloyalty to Trump and at various times his dislike of Trump personally. And that would be just one example. Obviously, during the campaign, there seemed to be a rancor every other week having to do with Trump and Ryan. At one point, you might recall, Ryan called Trump a racist. Or he called something Trump said racist, and I'm sure Trump took that to mean Ryan was personally accusing him to be a racist. Anyway, the point is, you see a series of leaks that seem to be exploiting this existent gulf between Trump and Ryan in the lead up to this vote. And you have some more interesting leaks that are really interesting. So, for example, this morning, John Harwood, the CNBC and New York Times reporter, tweeted that a senior White House aide told him that when he asked the senior White House aide if a decisive healthcare defeat today is best for Team Trump, the aide replied 100%. So the aide is telling reporters that it would be much better, unequivocally better, if this healthcare bill goes down to defeat in the House. And why might that be? Well, the bill on the merits seems awful. So it probably won't make Republicans any more popular. But on the other hand, the failure of the bill can be attributed by Trump to Paul Ryan. So it will be Paul Ryan's fault for not keeping his caucus in line, for losing control of various elements of the Republican Party, and for not being able to deliver this bill to Trump's desk. So at that point, Paul Ryan will be weakened, presumably, and Trump will be able to move on to issues that are more in line with the essence of the agenda that Trump promoted during the campaign. So this bill seems to be, you could call it Ryan care or Trump care. It's probably a fusion of the two, but it seems to be more in line with the Paul Ryan priorities. And Trump, knowing that the Paul Ryan political program is relatively unpopular, doesn't want to have his fortunes hitched to the Paul Ryan agenda. And if this fails, Trump can say to the Republicans, okay, I went with what you guys all prioritize here in terms of Obamacare repeal. I deferred to Paul Ryan. and you couldn't get it done. So therefore, I'm now in charge of dictating the direction of the party. So that'll, in a sense, empower Trump, and that seems to be what aides are whispering to reporters. Yesterday, John Bresnahan of Politico also said that Trump will move on and leave Obamacare in place if he doesn't get the votes today. That's according to Mulvaney, the Office of Management and Budget Director. So there does seem to be some backhanded maneuvering here. Trump's public advocacy of this particular bill doesn't seem to be quite as full-throated as you would expect if it was something that he truly did believe was urgent and needed. Trump obviously makes full use of his bully pulpit, and it's a little questionable how deeply he was committed to this particular bill. So the point is that there is, and the other thing is that the Obamacare, opposition to Obamacare, serves as what I would call a unifying agent for the Republican caucus, meaning it unifies disparate elements of the congressional caucus, which otherwise have pretty significant ideological divides between them. So if that issue is now removed, the party will probably sort of splinter. They can unify maybe a little bit around other issues having to do with tax reform, but even that is so complex, it's not as easy as just repeal this bill. That actually requires putting forth an affirmative plan in terms of tax cuts, tax reform, regulatory reform, that kind of thing. So if this is now off the table after today's vote, then I think you will see the Republican Party fracture a bit, and that'll leave an opening for Trump to set a direction for the party that is more in line with the priorities that he presented to the American public during the campaign. So I think Trump is obviously he's a manipulative person. He is always trying to play different factions against one another. And I think this very well could be an example of that. And the loser, presumably, will be Paul Ryan more so than Trump. Now, that said, Democrats obviously have wagered that it is in their interest to tie Ryan and Trump together as much as possible because Ryan's policy agenda, is unpopular. So that's why they've been calling this Trump care and so forth. But I think in actuality, the dynamics within the Republican Party are such that there is this gulf between Trump and Ryan that is going to be widening very likely as a result of today's events. But we don't know for sure yet. We shall see. The vote apparently is going to be happening in a couple of hours. So stay tuned and we'll discuss once it transpires. Okay, talk to you later.